Hi, I'm Dr. Don Bloswick, and I was Director of the Ergonomics and Safety Program at the Rocky Mountain Center for about the last 30 years. And I'm assisted here today by Dr. Andrew Merriweather, who's the present director. We're both now faculty in that program at the Rocky Mountain Center. And we're going to talk a little bit about how workplace risk factors cause musculoskeletal injuries, or sprains and strains in the body. While we're not really sure the exact relationship between workplace risk factors and back injuries, there's a general consensus that things that cause the back to be compressed and cause the disc to be compressed can often result in back injuries. And those compressive forces can result from high forces in the back muscle that's very close to that point of rotation, and that force in the back muscle results from when the torso goes forward, causing a high center of mass, causing a moment about this point, or when the load is held out from the body that causes a lot of force in this back muscle. Now, Dr. Merriweather is going to illustrate that, and he's been instrumented with a little EMG beeper that will tell us the force in his back muscle as he does other activities. When he holds the load close, the force in his back muscle is very low. When he moves the load out in front of him, we can now hear that the force in his back muscle increases. And if he brings the load back, it goes down again. He can set the load down on the table and just have his torso flex forward about halfway. The force in his back muscle goes up. So what that tells us is that there's several things we want to do in the workplace to reduce the likelihood of having a back injury. We want to keep the load close. We want to keep the torso as upright as possible while keeping the load close. We don't want to twist. Even though that doesn't change the compressive force on the back, twisting reduces the ability of the back to resist that compressive forces. And we also want to reduce jerking of the load, because when you jerk a load really quickly, the force on the hands is actually 2 or 3 times the actual weight in the box or on the load that you're carrying. So in summary, we want to keep the torso upright, keep the load as close as possible, don't twist, and don't jerk.